Good afternoon, everyone. We're here at the Collaboration 2014 trade event, and we've just listened to Dr. David Hornbrook and Master Technologist Peter Pizzi do their presentation this afternoon. And one thing that I wanted to ask them after hearing what they had to say was, dentists and technicians face a lot of different challenges trying to operate as a team. And so one question I have for them is, how do dentists and technicians overcome those challenges? What do they need to do, and how do they do that?
Can I start with that one?
I think you should start with that.
Great. I think it all starts with mutual respect, and I think the fact that we're coming from different sides, I'm coming from the intraoral with the live patient, he's coming from the model side with the articulator. I think it's important for me as a clinician, I'm speaking for every clinician, is to understand where he's coming from, so I can have an intelligent discussion. I think it's important as a ceramist, he needs to think, what am I dealing with? And, it could be a situation such as, why did I send him a quadrant impression with a full arch? Well, that's a very difficult patient. And the fact that he may appreciate that and understand it, he's going to understand why. So I think it's mutual respect and understanding and trying to think alike. We always laugh at, he thinks like a dentist, I think like a ceramist. And I think that's where it all starts.
Yeah, and to add to what he's saying, I completely agree. I think the truth of it is without plugging selfishly our meeting, the collaboration of dentists and technicians thinking alike and learning together is really the key. To do that, some of the onus goes to each party, meaning that technicians need to elevate the thought process, understanding of what's happening, and be able to be in that world to communicate that. And at the same time, so what Dr. Hornbrook said was mutual respect. I like to think that respect needs to be earned on both sides. I think the technicians need to earn their place at the table by learning, educating themselves, having a process to go by. And I think from the dentist's point of view, they need to earn that respect too by understanding what goes into technology today and the challenges that arise with that. How many times am I doing a ceramic demo that the technicians are all gathered around dying to watch, and the dentists walk by and just walk away? They don't see that value, and I think they have to see the value as well as we have to understand the blood and guts of being in the mouth, dealing with a person and who's hypersensitive, who's a drama queen, who has whichever issue they have that he has to deal with on a day-to-day basis.
Where does the dentist and the technician start that conversation? Or how do they? Is it somewhere? Do they go to courses together? Where do they begin that process?
I think it has to do with mutual goals, actually, to sit down. Peter and I actually got together because as we started talking, and we're relatively new friends, for a long time, is we kind of sounded, as he talked, he kind of sounded like I was thinking. And I think he probably felt the same way. And so, it's easy to talk to someone because it's a relationship, and it's an intimate relationship as we talk and we change people's lives, that we have mutual goals. And, it's easy for me to say, well, we talk all the time, or we call, or we do Skype. That's one way to do it, but how did we come to that goal? And, again, the collaboration, I think this is really my first experience with it, is an awesome experience for dentists to get to know ceramics. Because the dentists in the room come around and say, you know what, the ceramics are all interested. They're listening to it, and dentists as well as ceramics. They value that relationship. I want to pick one of these ceramics to work with, and starting that process, that pathway. I tell you what, it's a life-changing event for me. When I was a senior in dental school in 1986, I saw Bob Nixon and Dan Matterdamli lecture. And of course, Bob Nixon was really responsible for the whole veneer process, or at least educating the dentist. Dan Matterdamli was Da Vinci Dental, and I remember there just with my mouth open thinking, you know what? They like each other. They communicate. Those look like real teeth, and they love what they do. And I thought, relationship. They can have that marriage of the technology side, outside. And I think dentists need to go to lab meetings, and ceramists need to go to dental meetings and find mutual partners. Do you agree?
I completely agree, and I think the word that as you were saying that kept coming through my brain is a belief system. What do they believe? Because I can tell you, for me, the journey is about constantly getting better. And any opportunity I have to learn, to share, to grow, and sharing makes you better, by the way. Right? So any of those opportunities are about my belief. My belief is I want to do what's best for me, for the industry, for the patient. And I think we've lost a little sight of that over the years, right? I mean, in fairness, a dentist, they come out of school with $500,000 in debt and try to work and deal with insurances. And for technicians, maybe not having the education as prevalent as it should have been all those years, they're kind of beat down too. So there's kind of a disconnect at this point. But I think we have to find the passion. And for me, you could call it crazy, but my passion became about being the best I can be and communicating the best I can and changing the way this industry looks at it.
Well, I've got to say that your presentation embodied all that you do because it was passionate and it was terrific. And thank you.
Thank
Thanks
you.
for inviting me. I had
Yes,
such a great
indeed.
time.
Thank you.
Terrific. Thank you.